Heart Talk presents Dr. Mangesh Tiwaskar.
There are two different things. Heart attack deals with your heart.
Correct.
Stroke deals with your brain. So this 120 is what we know it as a systolic blood pressure, and 80 is what we know it as a diastolic blood pressure. The addictions, smoking, alcohol, tobacco use, but to protect your kidneys, to protect your heart, to protect your eyes, to protect your brain, you need to manage diabetes and blood pressure.
Welcome to Heart and Heart Presents, where healthcare meets honest conversation. Every family today knows dealing with diabetes, blood pressure, and heart disease, stress, or lifestyle diabetes. Yet, many people still don't fully understand how deeply connected this condition are. To help us decode this better, we have a renowned physician and diabetologist, Dr. Mangesh Tiwaskar, with us.
Namaskar.
Doctor, it's an honor to have you here. So starting with the first question that I would like to ask you, why are hypertension and diabetes often called the twin threats to health?
Perfect. Thank you, Disha. And hello, everybody. I am Dr. Mangesh Tiwaskar, and it's been always a pleasure to talk to all of you. Now, as Disha has asked me about why hypertension and diabetes are called as twin dragons or intertwined dragons, because these two conditions are currently the biggest challenge the Indian patients are facing as a healthcare system. Now, if you really look at the diabetes and hypertension correlation, you will be surprised to know that if somebody has diabetes, the chance of developing hypertension is nearly twice or more in the coming times.
Okay.
But surprisingly, if somebody already has hypertension, the chance of developing diabetes is even higher, around 2.5 times more. So, whenever somebody has diabetes or hypertension, patients have to be extremely watchful, and the healthcare providers also have to be extremely watchful in finding out whether the patient has developed any of these conditions simultaneously. So this is the reason why we have to be very, very careful and very watchful in not only diagnosing but also aggressively treating these patients.
Okay. Lovely insight.
Yeah.
How do hypertension and diabetes individually damage the body, and how the risk multiply when they are coexisting?
So even though they look like two different diseases, ultimately they join hands together when it comes to the complications.
Okay.
Now generally we have to understand that no matter it could be diabetes or it could be hypertension, the damage is generally through the blood vessels. So you can simply understand that blood vessels, they provide the battlegrounds for the complications.
Correct.
No matter irrespective whether it is diabetes or whether it is high blood pressure. Now I'll give you an example. Suppose somebody has an uncontrolled high blood pressure.
Okay.
Then the chances of developing the life-threatening challenges like paralysis, or what we know it as stroke. Somebody develops a brain hemorrhage. It's life-threatening. Somebody gets a heart attack.
Correct.
It's life-threatening. In diabetes, the challenge also simultaneously when the kidneys, they get involved.
Okay.
So when you have got high blood pressure, your kidneys are under stress. You have diabetes, your kidneys are doubly under stress. Now when they two come together, the risk to the kidney further augments. You have a damaged kidney, that adds to the uncontrolled blood pressure. More uncontrolled blood pressure you have, higher are the chances of developing blood vessel related complications. And these complications are always threatening. So for our friends, let me tell you that what are the normal blood pressure values that you should be looking at. Always understand that blood pressure is not single reading that we know. It's always a range. What we know it as a systolic blood pressure and a diastolic blood pressure. Systolic blood pressure is generally a pressure which is in higher value, upper value, which has been written by the healthcare provider or a doctor. And the diastolic blood pressure is a lower value, which is written as a denominator.
Okay.
Whenever the blood pressure readings are written. So commonly you must have read that the doctor writes down the blood pressure or the sister writes down the blood pressure as 120 over 80. So this 120 is what we know it as a systolic blood pressure, and 80 is what we know it as a diastolic blood pressure. Now what should be the normal range? Generally in an overall population above the age of 18 years, as you become adults, the range of blood pressure of systolic blood pressure should be anywhere in the range of 110 to 140. And the lower one, that is diastolic blood pressure, has to range between 60 to 90. Now, anything above that is called as hypertension or high blood pressure. Now, if the blood pressure values they stay higher than 140 or 90 for 2 or more subsequent readings of the blood pressure taken at least 2 weeks apart, then the patient or the person is labeled to have high blood pressure and the patients are put on with the treatments. Right? So this is just an overall understanding about what do you mean by blood pressure and why it is important.
Okay. So tell me, how common is it for the patient to have the both condition together?
Generally, when it comes as a hypertension, most of the times both systolic and diastolic blood pressure rises. Of course, there are select scenarios where only the systolic, that means the upper blood pressure, will only rise.
Okay.
And this especially happens in the elderly population. The moment you are above the age of 65, 70 or 80, generally the systolic blood pressure disproportionately rises in comparison to the diastolic blood pressure or the lower blood pressure. This condition is called as the isolated systolic hypertension. Of course, generally in the overall population, the blood pressure rise is simultaneously both systolic as well as diastolic blood pressure rises. And that is the reason why the common terminology which is used is called as systemic hypertension. Okay. There are very few situations where the diastolic will be only a little high, but you generally do not encounter that so commonly in the clinical practice. Okay.
Very insightful this is. What symptoms, if anyone, should prompt people to check for hypertension and diabetes?
Yeah, that's a good question. Now, what should I be watching for? Right? So the first and the commonest symptom that generally the people will start feeling is generally excessive palpitation or heartbeats. They become a little fatigued or exhausted. So they will start becoming breathless in doing their routine exercises also. For example, suppose somebody is habituated to climb 2 flights of the stairs. Now he or she starts becoming breathless, or they start experiencing the palpitations, that is unusual awareness of one's own heartbeats is called as palpitations. So somebody experiences that unusual heartbeats, breathlessness on the accustomed exercises, headaches, severe dizziness, giddiness, blurring of vision. All these can be indicators of the start of high blood pressure. You must go to your doctor as early as possible and get your blood pressure checked.
Got it.
Correct?
Yeah.
Right. And then depending on sometimes complications, lot of times it happens so in our day-to-day clinical practice that the people will come to us with the complications of blood pressure. So they'll start with straightaway heart attack, or somebody will come to us for the first time with already an established stroke, and then you realize, I was hypertensive. Okay. So the danger of blood pressure and why we should be always, aware about our regular medical checkups is this, that many a times it happens that blood pressure can be completely asymptomatic, and you only realize that you had it when you develop some kind of complication.
But these are found in mostly in both the categories, young and the adults,
Yes.
right?
Now, unfortunately, in Indian subclass of the patients or Asian subclass of the patient, the incidence of high blood pressure in the younger age is going up.
Yeah.
There are many reasons for it. The commonest being, number one, is that we have started eating, our culture has changed, food culture has changed from the regular home cooked food to home ordered food, right? We are so much eating junk food, which is usually very calorie dense, high salt containing, high saturated fat containing,
Correct.
low nutritional value food, which is dense with calories. We do not exercise. We hate to exercise. Number three, obesity is increasing. The weight is increasing. The addictions, smoking, alcohol, tobacco use, other abuse substances, the use is on the rise. And last and the most important is the stress level. The stress of life is going up. And along with it, to add to the story, now we have got mobiles and TV screens and computers.
Right.
So majority of times our screen times have gone up.
Correct.
Our stress levels have gone up. We do not like to exercise. We don't exercise.
Correct.
The most exercise parts of our body are these two thumbs. Unfortunately, that is a brutal fact. And on the top of it, there is an extremely affluenza of the junk food all around us. And unfortunately, I have to admit that now this junk food is the cheapest and most accessible food to everybody, all the classes of the societies.
Right.
So unfortunately, these are all have contributed to development of this kind of lifestyle diseases, what we call them as, like blood pressure or diabetes or the cholesterol issues or the obesity, right from the younger age.
Yes.
So ideally, in a normal regular scenario, the blood pressure is a disease of 5th, 6th or 7th decade where it can start of your life. Unfortunately, now it starts in 2nd or 3rd decade only.
Correct.
That's the trouble. Now we sometimes do not realize the importance of this, but if you really look into a wider perspective or a healthcare perspective of the Indian subcontinent, if you are diagnosed to have high blood pressure in an early age, that means that you are living that much longer. Your life expectancy has gone up. So you are supposed to live with this high blood pressure instead of maybe probably 20 or 30 years. Had it started at the age of 50 or 60 or 70, now you have to live with it with this kind of diagnosis and with the medications and the treatment on for 50, 60, 70 years of life.
Correct.
That is very important for us to understand.
Yeah. What role does regular monitoring blood sugar plays in keeping both them under control?
Yeah, naturally. As you keep an eye on the blood pressure readings, you have to also keep an eye on the sugar readings, because that will tell us about the status of the diabetes control. So whenever you are not only managing blood pressure, you are simultaneously managing the high sugars also or diabetes also. So you have to keep on frequently monitoring, and that has to be according to the healthcare advisor or the doctor's advice. Correct?
Perfect. Yeah. And what are the common complications when both the conditions are under control?
When they are both under control, mostly you will expect the rate of complications to go down. Means, of course, as the age of diabetes or as the age of hypertension progresses, as it grows, means that suppose now this year I am diagnosed to have diabetes or high blood pressure. As I grow up, the age of my diabetes or high blood pressure is also going to grow.
Correct.
Right? Now, with these growing up times, the chances of developing the related complications are there. They are going to be there. Correct? But if you are watchful or if you are careful about the control of both the diseases, the chances of development of these complications, they go down significantly. Lot of times they may not develop also, or if at all they develop, they are not that aggressive complications and they come very, very late in life. Correct? So it is as good as, following a traffic rule.
Correct.
If you are driving in a traffic, you have to follow the rules of traffic.
Correct.
That doesn't mean that you will never meet with an accident, but the chances of meeting with an accident, if you are following the rules of the traffic, are much lesser in comparison to if you are driving without following the rules of the traffic.
Correct. How can good management reduce the risk of stroke, heart attack, and kidney disease?
Absolutely. You keep these things under control. Naturally, you have stopped somebody from developing a premature heart attack. You have stopped somebody to have developed a stroke or a paralysis. Now close your eyes and imagine somebody who is known to you, who is very close to you, working, very well active, one of the earning members of the family, suddenly develops a stroke and is absolutely bedbound. And unfortunately, if somebody develops that, the rest of the life becomes a misery.
Right.
You are dependent on somebody for almost everything.
Right.
So you live what we call it as a vegetative life. And that is the ability that a stroke has. So I am generally scared far more to have a stroke than a heart attack. Heart attack sounds very dangerous, but it gives you an opportunity to treat somebody.
Correct.
And if I treat somebody in time, probably the chances of survival are far higher. And the quality of life doesn't change after that because of the recent treatment options that we have.
Correct.
But same is not with the stroke.
Correct.
You develop a major stroke, it's almost certain that you will have a vegetative dependent life or a restricted life. So life will never be the same as it was before the development of the stroke. Unless until you had a bleed inside or a hemorrhage inside and the doctors were able to salvage you and treat you immediately.
Correct.
But that hardly happens.
Correct.
Correct?
I was never aware that the heart attack and stroke are two different things. It's quite insightful to know.
Yeah. They are two different things. Heart attack deals with your heart.
Correct.
Stroke deals with your brain.
Correct.
So a brain attack is also called as a stroke.
Okay. Can one condition lead to another? For example, can diabetes cause hypertension and vice versa?
As I have told you that you have diabetes, the chance of developing hypertension in subsequent 10 years is almost twice, twofold increase in the risk. But if you have got hypertension, the chance of developing diabetes is 2.5 times higher in the subsequent 10 years of time. So both these issues, they go hand in hand most of the times.
Correct.
Because the reason is that these are all the diseases which are in medical terms called as metabolic diseases, or in the simple common people's term, they are called as lifestyle diseases. They are the two horses of the same cart.
Correct.
They will come in action at some time or the other. So be watchful. You'll have to be very careful. In fact, you must go to your healthcare provider to check for the presence of diabetes or hypertension if any one of them is already present with you.
At what age people should start getting screening for both the conditions?
Generally, when we say that once you cross the age of 40 years, you should start doing your annual health checks. But what we nowadays talk to people is that the first opportunity you get to go to a doctor or a healthcare provider and just do what? Check your blood pressure, check your blood glucose.
Correct.
How much time it takes. So if at all you have gone to your doctor for some fever or some sore throat or small medical illness, ask him or her to get blood pressure checked and a blood glucose checked. That's all. But generally, in a routine scenario, after the age of 40, at least once in a year you must check till the time you reach the age of 60. And then after the age of 60, the frequency has to be at least twice in a year. And then of course, if you already been diagnosed to have high blood pressure or diabetes or both together, then the frequency of monitoring will be decided by your doctor.
Correct.
If your sugars and blood pressure are under control, still you have to measure it every 3 monthly. But in certain scenarios, your doctor might ask you to monitor them more frequently.
But I have heard a lot of cases that once the baby is born, since the time it's born, they get the diabetes and the hypertension. Not hypertension, but diabetes is very common in the kids also.
Yes, but this is completely a different class of diabetes. I think we can have a separate podcast on this and we'll discuss on this some other time. But believe me, those kind of babies, what we know them as the childhood diabetes, is generally a type 1 diabetes, and the causes for them to have the type 1 diabetes are completely different. So maybe probably in some subsequent podcasts we might discuss about this.
Yeah. Are stress and poor sleep as harmful as diet and exercise neglect?
Extremely harmful. Stress leads to poor sleep quality. Lack of exercise will lead to poor sleep quality. More and more screen time will lead to poor sleep quality. Not following the food timings will lead to poor sleep quality. And poor sleep quality decides about the outcomes of the disease. Because we need to understand, and my friends should also understand, that to have a good sleep, it is having as good as a good garage for your car servicing. In sleep, the whole system goes for the repair or overhauling for all that has happened in 24 hours of the time that you have already lived. So all your systems, they are getting overhauled or getting repaired when you are sleeping.
Correct.
So a good sleep adds to a good repair work. So it's not only just the blood sugar or the blood pressure or the heart rate or the alertnesses, but also it is very important for your good immunity, a better response to the diseases.
Correct.
So everything sleep decides. Have a good sleep, and good sleep means a good deep sleep. Now, depending on the age, generally for adults, you should have at least 6 to 7 hours of a good sleep.
How much does family history increases the risk?
Yes, of course. If you have got somebody in your family who has diabetes or blood pressure, the chance of developing diabetes or blood pressure goes up, surely. Say, suppose either one of the parents has a diabetes or blood pressure. Now, let's focus more today on blood pressure. The chance of having a sibling or a child to have diabetes or blood pressure would be around 25 to 30%.
Okay.
If both parents are diabetics or hypertensives, then the chance of child developing hypertension or diabetes is around 70 to 80%. But if both parents are not diabetic or hypertensive, still, just because of the lifestyle, environmental changes, what we know them as epigenetic changes, the chance of developing hypertension or diabetes are still 10 to 20%.
Okay.
So it's
Yeah.
not that. A lot of times patients, they come to me, sir, we don't have anybody in our family who has high blood pressure or diabetes. Then still why I have developed? Because you have fallen into those exceptional 10 or 20% class.
Correct. Since both are often symptoms early on, how can people know if they are at risk?
Generally, people, those who are having a strong family history, people, those who are overweight, have a very stressful life, people, those who are aging, people, those who already have established diabetes or hypertension,
Okay.
smokers, tobacco users, and most importantly, the sedentary people will have the higher risk of developing these lifestyle diseases. So, if I have to really, I would say, risk stratify these factors, or what are those factors that I should be very watchful about. See, overall there are 10 factors which are responsible for increasing the risk. Out of them, 3 are non modifiable.
Okay.
You cannot do anything for it. Like what? Number 1 is your age. As you age, you are likely to have the risk of developing high blood pressure and diabetes is going to go up. Are you going to do something for it?
No.
You cannot stop aging.
Correct.
So this is one non modifiable factor. Number 2 is your gender. You should be a male or a female. It is not in your hands.
Right.
Males are generally found to have been at the little higher risk of developing the diabetes and the blood pressure or the lifestyle disease in comparison to women.
Correct.
Right? The third one is the family history. You cannot decide to which family you should be born.
Correct.
Right? So you cannot decide on what should be your family history. So apart from that, rest of the 7, like high blood pressure, diabetes, poor exercise, obesity, sedentary lifestyle, stress, smoking and tobacco use, alcohol use, and now stress are the factors which contribute to premature onset of high blood pressure or diabetes in the community. And these are all modifiable risk factors, right? You have diabetes, you have blood pressure, control it.
Correct.
If you have a stressful life, try to de-stress yourself with so many things which are available. If you have a sedentary lifestyle, start exercising, reduce weight. If you are a smoker or alcoholic or a substance abuser, stop the use.
Right.
So you can modify them, you can change them. So 70 to 80% of the job is done there and there on.
So, what is the role of salt and sugar reduction in prevention?
Wow, now that is a real good question. I would say these are two, I may not label them as poison, even though I want to say, but these are two white poisons of life, irrespective of how much you consume them. Generally, it has been found that the food becomes more palatable the moment the proportion of both salt and sugar goes up, especially sugar. And now we have invented different mechanisms and methods to improve the sweetness of the sugars. So, these two will always add on to the lifestyle challenge, the dietary challenge. And more you use them, higher it becomes challenging and more it becomes difficult to control diabetes and blood pressure. Unfortunately, a lot of people, they do not know that Indians are what we know it as, we are all salt sensitive hypertension people.
Correct.
Now, I'll simplify what do you mean by a salt sensitivity. Salt sensitivity means, say suppose if I eat 1 gram of sodium chloride, that is a common salt, what we use or what we know it as a table salt. So if I eat 1 gram of table salt, the systolic blood pressure can rise by almost 6 to 8 millimeters of mercury, and the diastolic blood pressure can rise by around 4 to 6 millimeters of mercury. This is after I eat 1 gram of table salt. Indian population, if I eat 1 gram of table salt, the blood pressure systolic can rise by almost 12 to 16 millimeters of mercury, and the diastolic blood pressure can rise by almost 8 to 12 millimeters of mercury. So the same amount of salt will cause higher rise in the blood pressure in the Indian subclass of the patients. Now what does that mean? It boils down to higher rates of uncontrolled blood pressures, blood pressure fluctuations, and more blood pressure fluctuates, more blood vessels they get damaged, and the chances of developing complications they go up. Correct?
Correct.
So when you suggest people that you genuinely need to treat blood pressure properly or treat diabetes properly, you have to insist on the salt restriction as well as sugar restriction. Very, very important.
The sugars like stevia and monk sugar.
Yeah, so what we call it as the artificial sweeteners,
Correct.
or what we also name them as sugar substitutes, in the prescribed formats, in the recommended daily allowances, they are fine to be used, they are very safe, and they also give you equal sweetness.
Correct.
But see to it that it is with the prescription and guidance of the healthcare provider.
Correct. Again, in the moderation.
Yes.
Yes. So how critical is medication adherence in avoiding complications?
Naturally, because if you do not take your medications regularly, you are not following the rules of the disease. If you take your medications regularly, naturally your blood pressure will stay under control properly. There will be much lesser fluctuations of the blood pressure, and the blood pressure will stay stable, will reduce down the load over the heart, it will reduce down the load over the kidneys, it will reduce down the stress over the brain and the other blood vessels.
Correct.
That will ultimately boil down to reduction in the rate of the complications. So taking medications regularly without asking any questions that how long I should take, why should I take it, should I take it for a lifetime? My answer to these people is this, that if at all you need to lead less complicated life with less medical challenges coming into the future, you need to abide to whatever has been recommended by your healthcare provider. If you do that, the chances of development of all these issues that we already have discussed will significantly go down.
Correct.
Right?
Yeah.
Because we have to understand that ultimately, if somebody has this kind of diseases, it's his or her personal challenge. It's her or his responsibility to see to it that the advices which have been given by the experts should be followed properly, because all the experts or the people, those who are giving you health care or bestowing health care on you, are your just team members. Ultimately, it is you, your system, your body, and your diseases that you have to deal in with.
Right.
So if you develop a complication, who would be suffering? You would be suffering, right? So if at all you need to stay away from all these complications, then you have to follow the rules of the game.
And what are the challenges that patients face in managing two chronic conditions simultaneously?
Generally, yes, it is difficult sometimes, and we as doctors, we understand it. For surely, we understand it. That yes, taking medications is not a very pleasant thing. Even we don't, doctors do not enjoy writing down somebody with, the list of the medications. We don't want to write down those. But then in a situation where you need them, it becomes mandatory for us to take the medications regularly. Of course, the challenges are the cost of the therapy, the the regularity. The patients have to take the medications for lifelong. So genuinely, yes. And in a Indian class of the patients where only one person is earning, that adds to the economic burden of the family. Right? So it is necessary for us to understand that we understand that medications can be sometimes, taking regular medications can be sometimes a challenge.
Correct.
But I would give you a different perspective altogether. The cost of prevention of the development of the complications is far cheaper and far easier than the treatment of the complications which are related to these diseases. And unfortunately, if you develop a complication related to these diseases, you do not recover what you have lost completely. Something will be left behind forever.
That's so deep.
No, it's true. Even though it sounds deep, but it's an absolute brutal truth of life.
Correct.
Bright as sunshine.
Correct. So the last question. Why are the kidneys so vulnerable when hypertension and diabetes coexist?
Wow, that is nice. Why kidneys are at the risk? Understand that the kidneys are the sieves of the body. They are not just sieves to, reduce down or take away all the waste material, all those toxic chemicals which are, released during our day-to-day metabolism, but also kidneys have got a phenomenal ability to control blood pressure. Kidneys have a phenomenal ability to regulate blood sugar. Your blood sugar goes high, kidneys have to filter more blood glucose outside to maintain your normal blood values in the blood.
Correct.
Right? Similarly, if the blood pressure starts going up, naturally the blood flow through the kidneys increases significantly. That will put an additional burden on the kidneys. When these two things they come together, naturally the kidneys, they run out of lot of its own resources because of the continuous stress put on the kidneys. There are so many different medical mechanisms. I will not dwell into it. Let us, for the simplicity of understanding, understand that uncontrolled sugars and uncontrolled blood pressure will be exhausting your kidneys far more faster in comparison to a well-controlled blood pressure and well-controlled diabetes.
Correct.
Otherwise, you may land up in all the kidney-related challenges, including premature heart attacks, including dialysis, including kidney transplants because of the kidney failure. And the worst is that if you develop what we know it as a end-stage kidney disease, even before people reach dialysis stage, majority of them, nearly 50% of them, will develop a premature heart attack and die. So it is mandatory and imperative to keep check on diabetes and blood pressure, to treat not only the disease related complications, but to protect your kidneys, to protect your heart, to protect your eyes, to protect your brain. You need to manage diabetes and blood pressure, not only effectively, but with the help of your doctor, your healthcare provider, and your family members. Please adhere to the rules of the game, and I'm more than sure about it that will reduce down all the possible challenges which are related to these diseases in your day-to-day life, and your life will become more livable. Because every one of us, including Disha, likes to say that we want you to live with these diseases. We don't want you to suffer with these diseases. And if at all you want to live successfully with the diseases like high blood pressure or diabetes, if you follow the rules of the diseases, I am more than sure about it, your life will be more livable than suffering.
Doctor, thank you for simplifying such an important topic so beautifully.
Thank you very much.
One thing that truly stands out from today's discussion is hypertension and diabetes may start silently, but it has a huge impact on our bodies.
Yes.
The encouraging part is that awareness, the lifestyle discipline, and timely treatment can make a tremendous difference. Thank you once again for joining us
I
today.
appreciate. Thank you for
This-
inviting me. Thank you very much.
This is Heart to Heart Presents. I'm Disha Jain. Thank you for watching because every heartbeat has a story.